Hey, Dementia Disruptors. I am fresh from the National Caregiver Day Symposium in Toronto, and I heard some really important statistics and insights that I feel like every dementia caregiver needs to know. So I'm going to share some of the things I learned, some of my thoughts, and some opportunities for all of us to both validate what we're experiencing and maybe find some resources. So, start with the numbers. 1 in 4 Canadians is a caregiver today, and 1 in 2 will be a caregiver at some point in their lifetime. And we're losing $1.5 billion in productivity because of caregiving in our Canadian economy. These are not small numbers. This is massive, and we are not talking about this enough. Here's another stat. 1 in 5 Canadians is now 65 or older. We are in what we call a super aged society. We have known this was coming for decades, but we have really not prepared for it. Not as a country, not in our communities, not in our homes. And I think that we're already in crisis, even if we don't realize it yet. Now, one of the big themes at the symposium was keeping people aging in place or in the right place, they talked about. And the focus was really on helping people stay in their homes as they get older. And we can see this as a priority. Here in Ontario, we have an agency called Ontario Health at Home because the whole purpose is to keep people at home. And I get it. I mean, I would love to stay in my home as I age as well. They found that 80 to 85% of people say they want to stay in their home, and only 3% say they want to live in long-term care. I understand that. The problem here is that governments and health systems are really pushing this agenda of aging at home, and that's great and a wonderful goal for some people. But I have to be honest, as a dementia caregiver, that this focus is adding tremendous guilt and stress to caregivers of people living with dementia. Because the reality is, for many people with dementia, it's just not possible to keep them at home safely. And I want to explain why, because I think this is really important for people to understand. When someone has dementia, they often don't know they have dementia. There's a term called anosognosia. We have some videos on that separately. It's really a lack of awareness of one's condition. So they don't accept that they need help. They don't understand why someone is trying to care for them or supervise them or support them in their home. And so that turns into them turning down support and resisting things. It creates safety risks. When they're left alone, it can create wandering, falls, medication errors, tons of financial vulnerability. And lots of physical and mental strain on the caregiver that is trying to make it happen, even with all of that resistance. And it is so unsustainable. So I know for us, our mom said to us after she had dementia that she was staying in her home and we could not move her. She did not want to move. And we had to make that decision to move her. And the amount of guilt that comes with that decision because you love this person and you want to do what they wish. And we try in everything we do to do what we think our mom would want. We make sure she gets dignity and respect as much as possible because this disease is so horrible and we know that that's what she would want and that what she deserves. But we just couldn't keep her at home safely. Um, so the guilt that comes with that, the feeling that you're failing because you can't keep your loved one at home, that is so real. And I want you to know, as a dementia caregiver, that that is not a failure for you. That is a structural problem. It's a mismatch between what our policy and what the advocacy is trying to fight for and what's actually possible for dementia care. So that's the first thing I really want to validate for you. If you are a dementia caregiver and you are thinking about or having to move your loved one into residential care, you are not failing. You are doing the right thing for them. Now, the good news is that there are people and organizations working on new solutions. And so at the symposium, we heard about the Canadian Workforce Alliance on the carer economy. This is something the Canadian government is launching, bringing together employers and Indigenous partners and post-secondary institutions, community leaders, etc., to think about how we support the caregiver economy. We heard from Liv Mendelson at the Canadian Centre for Caregiving Excellence, and they're doing some really important research and advocacy to make caregiving a national priority. One of the things that I thought was interesting was something called the Canadian Serious Illness Conversation Course, which was created by an organization called Pallium. And this, I think, could be really helpful if your loved one has just been diagnosed with dementia. A great resource to have some of those early conversations about what really matters while they can still participate. Um, we have in Canada a national caregiving strategy, and there's some provinces that are farther ahead of the curve. So PEI, as an example, has something called caregiving navigators. It sounds like a role that helps people who've received a diagnosis navigate community resources. And personally, when our mom got diagnosed with dementia, and we were deep in dementia caregiving, we were finding things on our own. We had no idea so many resources even exist. There is no central place to find out what's available to you, or none that I know of. So that's a gap, and one that we need to fix. So I love that idea of that caregiving navigator. There were also some interesting alternatives to traditional long-term care emerging. And, Scandinavian countries are so far ahead of us here, but we are seeing some of this starting to happen in Canada. There's something called nursing homes without walls. There's some compassionate communities where supports are shared with older adults and others, so that resources and support can happen within community. I think that's a huge opportunity. I think there's a huge opportunity to reduce the stigma of aging, reduce the stigma of dementia, especially, and help everyone across our communities, starting in school, to understand what to look for and how to support someone living with dementia. I think it's such a powerful opportunity for us. So I'm going to link to some of the resources and organizations I've mentioned in the comments so that you can explore what's most relevant for you in your caregiving journey. But here's what I really want to leave you with. If you are a caregiver right now, whether you are managing the care for someone in their home or in your home, or whether you've made the difficult decision to move them into care, you are doing such important work. There's no cure for dementia. The treatment is care. So as a caregiver, we are their treatment. And the statistics tell us that 1 in 4 of us are doing this right now, and you are not alone, even though it really feels that way sometimes. The resources and support we need are starting to come about, but you shouldn't have to discover them by accident the way I did. So share this video, share resources that you know about, talk about caregiving, talk about the challenges out loud, because the more we make this a public conversation, the faster things will start to change. More to come in future videos, but for now, I'll leave it there. Please ask me anything, ask my sister, ask us anything. And we are here to support each other on this dementia caregiving journey.